Hey everyone, good afternoon. I'm Susan Kaufman. I'm here to welcome you today to Attitude Magazine's ADHD Experts. Thanks so much to all of our listeners for joining us today. Our topic is ADHD in adolescents, and this is the second of a three-part series on the basics of ADHD across the lifespan. We're extremely pleased to welcome Dr. Timothy Wilens today to discuss key concerns in diagnosing and treating adolescents with ADHD. Dr. Wilens will be talking about strategies for managing the stresses and transitions into adulthood that adolescents with ADHD face, including topics such as the importance of preventative medicine, ways to manage stimulants safely, and much more. Dr. Timothy Wilens is the Chief of Child and Adolescent Psychiatry at Mass General Hospital, as well as a professor of psychiatry at the Harvard Medical School. He specializes in the diagnosis and treatment of ADHD, of substance use disorders, and bipolar disorder. Consistently recognized as one of the nation's leading experts on ADHD, Dr. Wilens has over 350 original publications to his credit. So we're very honored to have you here today, Dr. Wilens. Thanks so much for taking the time to join us. We appreciate. We know how busy a schedule you have. Before we start, let me just note a couple of housekeeping items. For those of you who are listening right now in the live webinar, you may download the slides by clicking on the event resources section of the webinar screen. If you are interested in purchasing a certificate of attendance, please look for the instructions in an email that you'll receive about 45 minutes after the live broadcast ends. If you are listening in replay or podcast mode, please visit the webinar page on the Attitude website. That's attitudemag.com/webinar/ADHD in adolescents, and you'll find access to both the slides and the certificate of attendance option. After his presentation, Dr. Wilens will be happy to take your questions, so please post them in the Q&A box as they occur to you today. And thank you to everyone for joining us on the ADHD Experts today. With that, let me turn it over to Dr. Wilens for his presentation.
Susan, thank you so very much, and it's really an honor to be asked to present. It's a wonderful venue. I just love this, and this is one of those times that we can escape the COVID restrictions and focus on ADHD. And really what I want to talk about is this transition time that people live from adolescence into adulthood. It's a major issue. You can do everything right. Many of you have done extraordinary jobs working with your kids and loved ones and getting everything set up and teed up. And then all of a sudden they get launched. These kids get launched, and there's some peril in that launch. And so what we want to do is talk a little bit about that and what are some of the issues that come up, and what are some of the antidotes, and what are some things that we need to be thinking about that we've learned from lessons learned from longitudinal or long-term studies. First of all, I just want to remind everybody, I don't need to tell you this, you probably already know it. It's obviously a common presenting neurobehavioral disorder, highly familial. But what I really want to focus on is the lower one, the chronic course, that the children continue with ADHD into adulthood. And if you're talking about an adolescent, most of them are going to continue to have ADHD into adulthood. So we really have to start thinking about our strategies early on. And one of the things you're going to hear me say is, we don't want to be thinking about our strategies when the individuals are already, 18, starting to think about this. Let's start thinking about this when they're younger and setting it up so that their trajectory works. So when they launch from your house, from your home, things go well for them. In this slide, you can see that we know that the childhood symptoms of ADHD decline over time. Hyperactivity and impulsivity in particular get much better over time. But what we know is that patients are still pretty much impaired by the age of 20. So in this diagram here, it really is, an issue when you see all these different numbers about who gets better and how many people get better from ADHD. There's different ways to define it. And the one that probably is the most commonly used is what we call functional remission, which is the blue line at the top, which means that if you look at how many people, are fully in remission, functionally, that or I should say the dark blue, which is at the bottom there, that you have only about 15 to 20% of kids actually, when they go, let's say, to 18, 20 years of age, 1 in 5 really have so much grown out of the disorder that they have no problems. But 4 out of 5, or in some stages 3 out of 5, still have quite a few problems. So I think it is the rule and not the exception that most kids are going to still be struggling with pretty significant symptoms into adulthood. One of the biggest changes that's happened in the newer diagnostic manual that we use, and I'm just going to focus you on in the middle, the change in symptom requirements, is that as you get older, they start realizing that to continue to have the diagnosis of ADHD, you don't need 6 out of 9 symptoms, you only need 5 out of 9. Well, you may say, well, what does that matter? Well, it turns out that about 10%, there's been a bump up of about 10%, the diagnosis of ADHD or persistence of ADHD. And the reason that it's also noted is that they realize as you get older, you naturally shed symptoms of hyperactivity, impulsivity, and inattention. Everybody does, people with and without ADHD. And to have the diagnosis of ADHD is made easier now because they realize that the old days, it actually was too stringent a criteria to make the diagnosis of ADHD in adulthood. So it's actually been relaxed a little bit because people appreciate that you may not have as many symptoms, but you can still have a lot of impairment as you go into adulthood. I'm going to stop for a second and give you a quick tutorial on brain development because what we're really talking about is brain development during this period of time. In other words, we're really describing that there's significant brain growth and development that occurs up through the age of 25, and some people say up to age 30, but it's really up to age 20, 25. So this is the age range that this is occurring. Another thing we know is that with ADHD, that brain development is slightly delayed. So there's a bit of a delay. So we're talking about important components of the brain that may be delayed with ADHD. In general, this is just to remind you, gray matter develops quickly during childhood, but slows during adolescence, and that the volume of gray matter starts to decline pretty early, actually, in middle school. And there's what's called a lot of pruning that occurs. And most of that brain development starts in the back of the brain and it moves to the front of the brain. And why does that matter? Well, in the next few slides, you'll see why it matters, because the front of the brain is the part of the brain that seems to be the most implicated in ADD. And the front of the brain, if you were to put your hand over your forehead, that area of the brain is involved in problem solving. It's involved in conflict resolution, impulsive decisions, dampening reactions, things like that, things that we know are affected by ADHD. It's slow to grow and slow to develop. That's why college students are still, high school kids, when they first go to college, they really haven't developed a lot of the skills. By the way, just as a fun diversion, a lot of people ask the question, what about psychostimulants and their effects on brain development, since we're talking about it? And I'll see if this animates in. The interesting finding is that treating ADHD helps reverse many of the abnormalities in the brain structure and functioning in kids. It actually has a positive effect. A lot of people say it normalizes your brain functioning and normalizes brain structure. So we used to worry about, does it cause neurotoxicity? The answer is no, but we're now seeing it actually may correct or help correct some of the this brain structure and function as people age. So differential brain development may explain observable problems in ADHD adolescents as they move to young to individuals. So let's just talk about brain maturation after adolescence. There's a study of young adults. The frontal lobes, as I said, show changes up to the age of 30. And that suggests that frontal lobe, or the front part of your brain, maturation is important for adult cognition. There's two major systems that we're talking about. One is the limbic system. I call it the sex, drugs, rock and roll system of the brain, and that's deeper in there. And what's interesting is that starts very early in life. And that's the one that gets turned on, let's say, by hormones. That's why adolescents go crazy for sex and drugs and reward and all of these other things. This part of the system is naturally there. It's a healthy human thing, but it starts very, very early. So it's well developed as kids go through adolescence. The problem is the oversight of the limbic system is the part that we just talked about, which is the frontal lobes. So we call them sort of the executive function. They're the ones that kind of dampen down, I want to eat more. Well, no, I can't eat more, because if I do, I'm going to gain weight. That's your frontal lobes talking to your deeper limbic areas to say, no, you can't do it. I want to drink alcohol. No, but I'm going to go drive, so I can't drink alcohol. That's that chronic talk that's going on between those areas. And you can see the list of things: judgment, planning, organization, problem solving, etc. In ADHD, the frontal lobes develop slower. So you already have kids who have symptoms of ADHD, but then their executive secretary of the brain is not as well developed. So that adds to a lot of the concerns we have and probably leads to many of the challenges that we see in adolescents who are growing up with ADHD. So not to scare you, but these are things we worry about. First of all, you're taking kids who are going into higher education, going into the trades, going into military training, and there's increased demands. More tests, more homework, missing assignments are no longer looked upon very lightly. There's college applications, board examinations. Kids are going on for occupational independence. I work with a kid with ADHD who's going through to be an electrician. I tell you, he brought in some of his textbooks, and I'm a little bit of a geek that way. I still enjoy electrical engineering and materials, and I was shocked at the amount of information that was required. This kid has to be able to learn, has to be able to get through this, and is struggling a little bit with that. We worry about substance misuse. We'll talk a little bit about medication diversion. If you have kids who are in sports, right now nobody's doing sports, but if you were doing sports, and if they're going on to play in upper high school, if they're doing some kind of a trade, or if they're going on to college, some type of college sports, the playbooks are extraordinarily difficult. They're complex, and they change. These are not 5-page playbooks. These are 30, 60-page playbooks. Some of them are changing every week or every other week. So there's demands. There's also a higher level of play, and then self-imposed issues. You're expected to do training on your own, and you're supposed to maintain a certain diet. And then there's other areas, social. There's, many kids with ADHD have issues with social. Now they're losing their friends from high school, and they're losing their parents. There's the driving issues we'll talk about, as well as other psychiatric co-occurring issues. I talked about social, but I wanted to comment that these are some things we know. These are kids that have more social isolation and more friends who may be struggling with conduct issues, more delinquency, and just not as engaged with social activities. And it's something that we worry about. And as they move on, I think as parents, reaching out and trying to help them establish some type of peer relationships, helping them, guide them to join a group, join some type of a social club that would fit what they want. If they're not readers, to put them into a book club is fantasy, but to get them connected to some type of a thing that would fit with who they are as kids, if they like sports, if they like to weld, if they like this or that, can be very helpful. We know some of the things we're going to be worried about as kids launch are things that we know occur in adults. For example, dropping out of high school, we really want to fight that. That really has an impact on your future hireability and income, the capacity to keep people away from drugs, cigarette smoking. This is actually a time when we see dramatic increases for ADHD with cigarette smoking, and then things such as arrest and then other kinds of concerns. Other things we talked a little bit about is driving. So one of the areas we worry about with driving is that in general, across the bridge, it's about a 2 to 3-fold increased likelihood for motor vehicle accident, for injuries, speeding tickets, etc. The good news is that that treatment of ADHD, if they're on medications for their ADHD, we can see almost complete reversal in the deficits of driving, and these numbers go back this way. So treatment is absolutely mandatory when kids are driving, along with reminding these kids the basics that our data would indicate that distractibility during driving is the biggest concern that we have. And here's some good data. This is what I was saying before. This is looking at big data sets. This is 2 million ADHD individuals. This is smaller, but it's in 2 different countries. And if you look at those who are treated versus those who are untreated with ADHD all the way to the right, there's significant reductions in periods in the number of motor vehicle accidents. So you can actually reverse motor vehicle accidents in terms of that. In terms of sexual behavior, we know that these kids tend to get involved with sex a little bit earlier, more sexual partners. Now, this group, I want to comment, in the Milwaukee study had a lot of co-occurring delinquency, and that may not be such a problem for kids who don't have delinquency. What about new diagnosis of ADHD in college students? Because this is clearly what we're talking about. Can you make the diagnosis? Absolutely. And so if your kid is in college and struggling, it's really an interview with the student and others. There's some questionnaires that can be very helpful. And oftentimes, college practitioners have concerns that kids could be trying to dupe them or maybe trumping up their symptoms to be able to get medicines. So often they'll ask for parental involvement to be able to verify the child's difficulties when they were in high school and their current difficulties. So that you might be asked as a parent to fill out a rating scale to be able to help out. And that can be very helpful as a practitioner for that. A lot of times I ask the kids who I'm seeing who will present if I can have a quick conversation with parents so that I can then talk to you about what might be symptomatic at home. You know, they've had long-standing problems with this. Maybe you've been helping them with that, and now they've lost that capacity since they're at school. And what might, so it helps me diagnostically understand them. So I think in that situation, helping to promote that they go and get a diagnosis if you have concerns, and part B, being available to have a quick conversation, whoever the practitioner. Often nurse practitioners fulfill this, but to be able to just speak with them briefly to help with those issues. This is a complicated thing. This is just looking at educational levels of adults with ADHD and where you would expect them to be. The red is what you would expect based on the IQs of samples of ADHD individuals in this study. So we know that IQ predicts how people will do and how far they'll get through school. You may not like that, but that seems to be a very replicable finding. This is where you would expect ADHD in the red to be. So in the red, you'd expect most based on this IQ profile to be at college grads. Where they actually are is in the blue, and that's partial college. And in fact, when you look at it, it seems that ADHD for college students, and this would be also, this has been more studied in college students, but it would be for people who are going to the military, individuals who are in the trades who have many challenges in terms of learning their materials. It costs about 10 IQ points. Doesn't mean you're dumb or anything like that. It just means that you're going to perform about 10 IQ points less well than you would if you didn't have ADHD. And I think that's helpful to realize that, because that's 10 IQ points is quite a difference. It's between being bright and smart and average and borderline. So it's a big jump. That's a whole standard deviation. And that's what ADHD, quote, costs you in terms of how much harder it is for these individuals. So I like this: to do good things is noble. To tell people to do good things is even a lot nobler and easier. And Mark Twain says that well. And as we move to what do you do, first of all, educate about ADHD individual strengths and weaknesses. When you're talking about what to do with a transitional aged youth who's going to college, going into the military, et cetera, and you're thinking of reshifting the treatment plan, they need to tap into online resources and these types of webinars are invaluable, and that's why it's an honor to be part of this, because this is how the information gets out. Kids should be getting aid in the implementation of any type of accommodations that are necessary. That's absolutely vital. There's data to support that that's exactly where kids do better. So there's older studies from the University of Iowa that show kids who use the Learning Disability Center do better than kids who have ADHD or kids with ADHD and learning disabilities. So connecting kids to that. If there's resources through the unions to assist these kids. In the military, there may be assistance that they can receive if they're interested in learning different trades within the military with some type of accommodations. Consider vocational assessment and career counseling can be very helpful, especially when you're sitting there saying, I don't know really where we're at with my son or daughter. I can't tell where they're at and what's really right for them. Well, think about taking a step back and seeing what might they be good at and what might be good for them. And this can be done by somebody who's independent who meets with them. And then finally, set reasonable expectations about medicines and psychosocial treatments. They're not going to be cure-alls. There's still going to almost always be extra symptoms that are still there. They still may be struggling with some inattention or some distractibility. But, but what can you expect? Usually you can expect about a 50% decrease, 50% decrease in symptoms, and that's what you should aim for. And then what other things can you do? You may, if you're using meds, I can tell you, you may need one medicine or you may need two medicines. How do you cope some things with ADHD in college is, first of all, kids have to realize if they're going to college that they have ADHD and they can't bury their head in the sand. That's a huge bridge, and that one starts earlier. That one you don't have that conversation at age 18. You start having that conversation at age 13, 14, 15 if you have the capacity to. We've already talked about accommodations, but you can see there's many accommodations that can happen in the college setting that can be extraordinarily helpful. Empower kids to advocate for themselves, but you also have to provide oversight to be sure they've gone to the right place and that the things have been integrated as agreed upon. So I would say have your kid do that, but I actually am an advocate for helicopter parents with ADHD because if you don't, there could be a lot of failure. So I'd rather you be involved and start to de-accelerate as the kid continues to get through school, but we want success. Another thing for kids is for them to really develop self-help positive habits. Like they've got to get enough sleep. They've got to eat properly. There should be a component of exercise, walks, things like that. And when they get stressed, more and more there's resiliency training, teaching them to take deep breaths, teaching them to manage their dysregulation or anger, helping them manage when they're feeling overwhelmed. This positive self-care habit should start earlier also, but for college, they need to really engage in that. And as a parent, you can talk to your kids about that. How are you doing? How much are you sleeping? What are you eating? How much exercise are you getting? And what do you do when you're getting stressed? Structure is your friend. Regular study periods. I always tell kids, you take your meds, it's like a job. You work when your meds are working. Many of these kids are on stimulants, for example. They only work for, 8, 9, 12 hours. Sometimes you can get some additional up to 12, 14. These are not kids who can be jamming at night because they can't be taking stimulants at night because it keeps them up. Again, you can use some medicine combinations to help, but what they need to see is that their job is to go to school and to do as much as they can when the medicines are working. This is not a time that they should be putzing around during the day. They should get up early, start working at 8 o'clock, take their meds early, eat, start working at 8, 9 o'clock, and do their work when the medicines are working, so that during the day, each minute of the day is studying or going to class. They don't just take the medicines as needed, and that's another thing that's there. Another thing is to consider reduced load during first semester in particular. First semester is often a very tough time on a kid with ADHD because they're on their own. All of the things we've talked about, they're not used to everything being at the end of the semester. No matter how hard they study, everything jams up at the end of the semester and they can feel overwhelmed and shut down. So sometimes people start a little bit lower on their first semester, 4 instead of 5 classes, and some of that is really for the end of the semester when things heat up and come at you. I think I've already talked about learning to study during medication times and the importance of that. There's different types of therapy, by the way. We've talked about, medication, but I just want to comment there's both group, and I'm just going to bring these up. There's both group and individual, and there's online now types of therapy. Cognitive therapy can be really helpful for these kids, even if they don't get the full course, because it helps them focus, it helps them learn how to attend, it helps them learn how to compensate for residual symptoms. It teaches them what are the patterns. A lot of times kids have patterns where they do the same thing and then they strike out, and then all of a sudden they don't even try it anymore because they know they're going to strike out. So this helps you sort of understand what are you thinking, what are you doing, and what are the consequences of that combination. Medicines are very helpful for ADHD, and our data shows they work in kids, they work in transitional age youth, these adolescents going to adults, and they work in adults. And the regimen we use largely are the same, although in the middle you see the antihypertensives. They should really be renamed the alpha agonists. clonidine and guanfacine. Sometimes people hear this as Intuniv and Capve. Those medications we tend to use less as the kids exit adolescence and enter adulthood. But all the rest of the medicines are basically the same in any age group. Med adherence. So meds can be very effective. And again, what do you aim for? You really would like to see about a 50% reduction in the symptoms. And it can be helpful to identify your target symptoms and then cutting those back by 50%. My kid has problems when they're studying. They can't stay focused on what they're doing. And then and those are the things that you would focus on. So let's say they get distracted easily. So you be sure that those are the things they bring up with their practitioners. Everything can be done right. You can have the best medicine, and look at that. Poor adherence, 20% continued meds at 1 year. If you look at how many are continuing to take their meds on a regular basis, most people stop. They forget to take medicines. They don't like the side effects that they find some blunting. They're in denial about certain things. And there's stigma. Some people just feel embarrassed. They feel defective, so they don't want to take them. Then there's some logistical issues about the cost, that they're having to pay copays or they don't get the copays. What helps that? First of all, really having the kid engaged and putting them into the and next is text messaging can be helpful. We know in addition to ADHD, there's a number of other sort of disorders that are getting picked up in individuals as they age, and things that we worry about from left to right are these kids get depressed, they can have more severe bipolar symptoms, they can have tic disorders, they can become oppositional. But really the things we worry about, depression, and the other one that should be listed on there that isn't, is anxiety disorders. And it just shows you when you have ADHD, you're a lot more likely to have these issues. And many of the times you see the manifestation of that during this transitional age time. The good news is, and it's almost impossible to see here, the red is what happens. Higher scores are worse, lower scores are better. And you can see for depression, anxiety, oppositional disorder, if you're not treated with stimulants in this study, the red, it's higher than if you're treated with stimulants in the blue. That is that not treating people's ADHD over time increases the likelihood that they'll have depression, they'll have anxiety, or they'll have oppositional disorder. So treatment actually is protective against the development of a number of disorders. I want to shift here a little bit to substance use, and this shows you one study that looks at the development of substance use in ADHD, which is in the red, or controls. Higher scores are worse, lower scores are better. So ADHD has an increased risk for substance use disorders, and some studies show it's twice the risk across the age span, and that also includes cigarette smoking. We know that in addition to that, as kids grow and age into adolescence, that substances of abuse are really deleterious in adolescent brain development. So, for example, just alcohol alone affects learning, information recall, memory. It affects your capacity for vocabulary, and it also disrupts sleep, which has downstream effects on both mood and attention. If you talk about marijuana, we know, especially before the age of 16, has real problems with both white and gray matter in the brain, both the thinking parts of the brain, the gray matter, and then the connectivity of the brain, the white matter. In addition, it has a very negative impact on areas of the brain that are involved in executive functioning. So there's this shows some of the improvements that we see. This is if you treat individuals prior to the age of 9 with stimulants, you wait until they're 10 to 14, or you wait till after 15, and you treat them over time, what you see is an improvement in the rates of marijuana use in those who are treated with stimulants and are started at an early age. So we can reduce substance use, and if you have younger kids, diagnosing and treating early is a win-win, and we argue for starting these medicines early so that we can help reduce the likelihood for, in this case, just marijuana use. And this, again, is right at that interface. These are high school seniors. And always is a question as we're talking about substance use, what's the overall impact of early treatment of ADHD on later substance use? And you can see if you look all the way to the right, almost all of our arrows are down. So essentially, all of these things have been an area of my research for many years, as you see significant reductions, especially in the huge studies like the top one, the Quinn study with almost 3 million ADHD kids growing up, that there was a significant reduction with those treated versus untreated, and during times when kids are treated versus times when they stop treatment. So treatment of ADHD all the way through is important, and you don't want to stop the treatment at age 12 or 14 because risk for substance use really is a adolescent to young adult thing. So you really want to keep people treated all the way through that period. I want to end by talking a little bit about something that we do need to monitor our kids for, which is stimulant misuse and stimulant diversion. Misuse is really either kids who are not diagnosed with ADHD who are misusing drugs like Adderall or Ritalin. Diversion, and it's also misuse in that population of kids who are, let's say, prescribed medicines, and they increase the dose of the medicine or they take them at night. So I treat a number of college students, for example, and kids who are, who are working, and sometimes they'll tell me. I appreciate their honesty. It's almost like too much information. I'm sure you've dealt with that with your own kids, but they'll tell me and that sometimes they take their stimulant at night, and I'll say, well, doesn't that keep you up? And they go, yeah, but it keeps me up, and that's good because if I drink, I can stay up later. Otherwise, I fall right asleep. So that's considered stimulant misuse. Diversion is your kids who may be diagnosed and treated for ADHD selling or giving to other people their medication. And they really need to be warned about that, and we'll talk about that later. We estimate that about 10 to 20% of kids have used stimulants non-medically. So it's not. It's a common phenomenon. 1 in 5 kids in our country have used stimulants, and they shouldn't have been on stimulants. They don't have the diagnosis of ADHD, and they're not treated. Most stimulants are diverted, by the way, from friends. So most people get their stimulants from other kids with ADHD. That most of them aren't scamming the local docs, and most of them don't see it as potentially dangerous. One thing we've learned is when we've looked at kids who do misuse stimulants, this is a little bit difficult. Higher scores are worse, lower scores are better. We find that if you look at the rates of substance use in those people who are misuse stimulants, it's about 50%. About 50% of the kids who misuse stimulants have substance use compared to the college students. So we know that misuse of substances in general goes with misuse of prescription stimulants for ADHD. And why do kids misuse prescription stimulant medicines? I'm not talking about cocaine or methamphetamine. I'm talking about, Adderall, Adderall XR, and the rest. It's because they don't seem as dangerous. They don't seem as addictive. And the big issue is they don't see any ethical and moral issues, that there's a responsible misuse. And we remind people that they are, in fact, ethical creeds that most institutions have, the military, most trade groups, unions, they'll test for it and you'll get thrown out. Colleges around misuse of that. Other things such as they're not illegal because they're prescription, they're easily to share with others, it's a social issue. And of course, parents, and I would add doctors, are unaware that it's occurring. Just for fun, a lot of people ask, are rates of ADHD higher in people who misuse stimulants on the streets? And the answer is, yeah, it's higher. But it doesn't account for all of it. We also know that there's more neuropsychological problems, maybe not ADHD, but other things. More kids tend to misuse the immediate release as opposed to extended release. So they use Adderall, but not Adderall XR. They use Ritalin, but not Concerta. So we recommend the use of extended release stimulant preparations when at all available. Almost 1/3 of misuse of stimulants, by the way, is sniffed. So if you know your kid is misusing or you've heard that, they actually grind it and sniff it. And that brings with it higher rates of other medical problems and other things. And we know that stimulant misuse is also linked to some other issues. And I think we've already talked about this. So I just want to end by saying that in general, this is a huge critical time for independence and development. You can do everything right when a kid is younger, but you really want to set up for discussions about important changes that are going to occur when they start to get older. And so that mantle starts getting handed off as kids go through high school. There's a strong neurobiological underpinning suggesting continued brain development through adolescence into young adulthood. And that's already challenging for all kids, but it may be delayed in ADHD. So you're really going to have to handhold your kid longer through that period. Work with youth to monitor their ADHD, their general activities, their study habits, and when I say activities, their lifestyle, eating, exercise, how much substances are they using, and are they smoking cigarettes, are they vaping, and if so, how often are they doing that? Treatment really needs to be maintained and encouraged on a regular basis. It's like mask wearing during COVID. It's hard to remember to always wear a mask during COVID when you're under certain circumstances, particularly in this population. So very similar to that, any behavior that needs to be repeated, such as taking your medicines every day or doing therapy once a week or every other week, whatever the maintenance is, or going to the study skills group or doing your homework, that vigilance falls off over time. So you as a parent can really help with that. And then I would also ask that, check pill counts for kids that you may be working, your own kids or other kids that you may be supervising, to ensure that they're taking their medicines properly and they're not giving them away. One thing to remind people is if you give away your medicines or sell the medicines, you get caught. Depending on the quantity, it can be a major arrest. It's no longer a misdemeanor. It's a felony based on the milligrams. If somebody has a problem because of it, you could be held accountable or culpable because of that issue. I don't want to leave you with all of these, oh my God, this is a tough and scary time. It's a fun time. It's an extraordinary, rewarding time to see these kids grow and really flourish. And I have to say that one of the great honors and one of the fun reasons I love being a child and adolescent psychiatrist and taking care of kids. I take care of a lot of kids in my hospital-based clinic, is to watch them grow and launch. I really love watching these kids come back over the holidays to see me, to watch them grow through college. They do get through it, even though the parents are often battered. The kids get through it and they do well, but I think they need special attention by yourself. So with that, I'm going to pass this back over. And
thanks so much, Dr. Wilens. That's really a fascinating overview and a great presentation. Tons of questions here. There are some parents whose children are either not diagnosed and they're wondering of the merit of diagnosis, or their children are resistant to the notion that they have ADHD and that they need to treat it. What's your feeling about the importance of naming the disorder and any strategies you might have for helping parents help their children accept and pursue, treatment strategies when there's lots of denial?
It's a great question. Yeah, it's a huge question. So first of all, I think it is important if a kid is struggling, if a kid has cosmetic components of ADHD where they have some, but they just, for whatever reason, can escape the grips of the ADHD, I think it's less important. I think it's really if the kid is struggling, functionally impaired, or suffering. So struggling, suffering, or functional impairment associated with it, that would be the threshold where I would treat. And I think for those kids who are in denial, who don't want to talk about it, I think if you see that in your own kids, it's worth having a conversation. And as I always say as a psychiatrist, is leave the door open. Not everybody is there. They're not there. You can't tie them down and force meds and force whatever, a diagnostic. But you can open it up and say, this may explain some of what is why you're struggling. Attitude and others are phenomenal. They have all these articles that are really helpful for kids, and you can access those and recommend that they see that. They will probably look on their own. Kids are so savvy about searching, and that often comes up. But I do think you keep the door open, and you do keep a sort of a subtle pressure, and not I told you so, but to say, I think this might explain, this might be helpful. You were previously diagnosed. This is rekindling itself. Help can be there. Again, if a kid is suffering, struggling, or impaired, that is an indication that they need treatment.
Okay. A significant number of listeners are really not comfortable with medication. And the question that's come up frequently here is, are there alternatives? For example, specifically, what's your experience with neurofeedback and with meditation? Do you see, have you seen any success with non-medication treatments for teens or adolescents with ADHD?
Yeah, so I do a lot of work. I'm more of a psychopharmacologist, so I use medications. But in some ways, I can tell you that if you look at the literature, the aggregate literature, there are some, I would say, more mild effects of using either nutraceuticals. So some people will try fish oils, and some people will try inositol, and some people will use ginkgo and other things. There's maybe a mild effect of those, and they can often help with some of the mood components that then can keep kids from being able to concentrate and focus. And they have mild effects, but not really robust effects. Neurofeedback is probably a mild effect. It's not been really demonstrated when you look at reviews where they've looked at that. It can be extraordinarily helpful for anxiety. And sometimes when you can slice anxiety from a kid who has attentional problems, their attention gets better. Almost uniformly, if you can get rid of anxiety, attention gets better. So that can be helpful, especially if they can self-write to some degree. People have looked at some online trainings. So sometimes for certain types of attentional issues and certain type of cognitive functioning, these online programs, like the one that was just FDA approved, could be helpful. But if you look at ADHD symptoms, for example, it doesn't really improve that. It does help some neuropsych components of ADHD. And is it an unreasonable attempt? Probably not. It's a video game-like, program that you can do. And kids may want to try that first. And then if that doesn't work, or if they only get a partial response, then they might be more interested in medicines. The reason we talk about medicines is just that the effect is so profound. It's a major effect, especially in this age group. You don't really need to worry much about the side effects of the medicines, and they can really reverse a lot of the symptomatology of ADHD. So, I'm a believer just because I've been treating it for so long, and I see people try complementary and alternative medicines and systems to try to rectify their ADHD. And again, usually it's just a mild effect, and sometimes that's adequate, but most of the time they require more of a significant intervention.
Okay. Here's an interesting question from a parent, and I think this question reflects something that we hear frequently at Attitude. He says, I'm torn between whether my child should focus on stimulant medication or develop grit, emotional muscle, and behavioral strategies. In other words, learn to cope with, I guess, the symptoms of ADHD. Can you help me assess the payoff of each approach? And I think the concern seems to be here, and I think I'm sure you're familiar with this, that stimulants will somehow impede the development of coping strategies that might be lifelong or might need to be lifelong.
Yeah, it's really a great question, I have to say, because the answer to that is they should do both. I think these kids all need resiliency work to be able to manage the ups and downs of life, the grit, as you said, to use the word of the questioner, to develop some of that, to manage downtimes, uptimes, to learn how to deal with things. I think that, there's these I introduced the whole idea, and I really need to get a less academic slide and a better, easier slide to understand what sort of cognitive techniques teach kids about A, to develop coping skills to manage some mood and anxiety, B, to how to enhance your attention and how to reduce distraction, how to not have negative thoughts that lead to negative behaviors. There's a whole concept, and I think kids should have that. I think they should have a run of that. I think kids who have organizational issues, which is often a proxy to what we call executive function, should have organizational training. I think that that's really important, and I don't think that medicine is part of that equation. I think that these trainings could be helpful. But I also think medicines are very helpful. The effects of medicines are very strong. What you don't want are people being 100% dependent on their medicines and saying, I can't do something unless I'm on meds, because A, there's going to be times before and after that you have to do things. B, that the medicines are not 24/7, although we're getting better at developing them. There's some in development that may be more 24/7 coverage. And I think that the combination of the grit, resiliency, plus the medicines really, converts into a happier, more thoughtful, more competent kid.
So I think what we're talking about is maybe cognitive behavior therapy plus organizational therapy. I know we've had some terrific presentations on cognitive behavior therapy. It sounds like that's only a plus for teens with or college students with ADHD.
I think so, and I think it's not all of them need it, but I think certain kids may benefit from a touch-up, or at least learning the bumper sticker version of it, understanding the basics of it, and trying that.
Right. Okay. That sounds great. I want to turn to the question of IQ. You mentioned that I guess having ADHD effectively gives you a 10-point IQ disadvantage relative to where you might be with it. That raised the question for some listeners. Is it common? Can you be gifted and still have ADHD is one part of the question. And the other part is are people with ADHD less likely to be gifted? So is there any relationship between ADHD and IQ overall?
No, there's actually not. It's a great question. There isn't overall a relationship. And so to answer your question, and I'm going to, half the people listening are going to be happy and half are going to be sad. I'm going to get a bunch of emails to say that no, it doesn't mean you can't be gifted, but it also there's not a bias that there are more gifted people. And I have to say, people say ADHD is a gift. Kids with ADHD are special. Part of it is you really have to lean in and you're really working hard with them. And God knows I just adore kids with ADHD. I love working with kids with ADHD. I love working with adolescents and adults. That's why I like this. Super rewarding, etc. But what I say, it's a gift. It is not easy to have ADHD. It is not a cosmetic disorder. This is not a trivial disorder. This brings with it, as we showed you, a lot of difficulties. There's struggling, suffering, and impairment associated with it, and all the long-term studies show that. So I'm not sure there's a gift to it. Now, can you harness what ADHD leaves you with and use that to your benefit? Well, I would say that that's just a good life lesson in general, to be able to harness whatever your strengths are and diminish your weakness in whatever you move forward. So I think that's just really good, knowing yourself, existential planning. And in that regard, yes, then I think if you can harness some of the incredible capacities that ADHD kids do have because of their ADHD, then that's wonderful. But I wouldn't say that there's a gift or not gift with ADHD. I would keep it neutral.
Okay, that makes sense to me. So a number of the listeners have children who have tried ADHD medications and abandoned them because of side effects, because they don't like the way it makes them feel, because of tics. What's the best strategy to pursue in those cases? Again, I don't want to just be a one man. I think it's great because, like I said, this is a great time to utilize my expertise, because this is what I do day in and day out as psychopharm. I have to say that, a lot of the things that, for example, I've been writing and have put into books and other things is how do you manage side effects to non-stimulant medicines, stimulant medicines, etc. There's a small minority of patients in my practice where we just have to say meds just aren't right for you. We find stuff. We just keep trying. We try this medicine. We try this at a lower dose. We shift to this medicine. We add this medicine. We try two medicines together, and I would keep an open mind about that. So I don't think it's a majority of kids. I think that it's a very small minority. And I would say go back and take a look. Keep your kid open-minded. One of the best things you can do is just have the kid very involved in the treatment. And you need to laugh a lot more than you cry. When things don't work, try not to get despondent. Have a practitioner who's in there arm in arm with you, saying, hey, I'm going to hang in there as long as you are. We're going to find something. We may need to be going out and trying more esoteric stuff, but it's certainly worth trying. And meanwhile, while you're doing that, what are some non-pharmacologic things you can do? What we talked about, is there organizational training? Is there certain types of accommodations that can be met?
and other things that you can be doing also that are only going to help your overall capacity to manage ADHD and the related issues. But I would say don't give up and keep trying, because, again, I would estimate that maybe only 5% of my caseload I have to put up the white flag and say there's nothing I can do. 95% of the time we find something.
Interesting. So I think that's a challenge for our, I know an attitude challenge for our listeners to find someone to work with, a practitioner to work with to really titrate. But
if I can say something,
sure.
it's worth looking. It is. And if you're working with a pediatrician or somebody who's not doing this, full time, it may be worth the extra time, effort to seek somebody out who has expertise in that. And inevitably it's going to be a wait list, but get put on that wait list. It's really worth it. You don't go to your primary care doctor. Sometimes primary care doctors can do a phenomenal job with ADHD. But, you don't have thoracic surgery done by a pediatrician or a general internist. You wouldn't even think about that. If your kid has, bipolar disorder or anything else like that, God forbid, you're not going to let your primary care doctor manage that. You really need somebody, a developmental and behavioral pediatrician, a child psychiatrist, somebody who has a lot more experience with all the different meds that are available for ADHD. So, again, I would go back to that and say, think about going back again one more round and advocating for trying some unique, newer things, combination medicines, et cetera.
Right. And I think to your point about finding a specialist, that's something that's very hard for our listeners and definitely worth pursuing. Here's a comment, which I'm just going to read. Starting medication is frightening for my daughter. It changed her life for the better and allowed her to be who she is. The first med was not the right one, but finding the right balance was life-changing. So that's a comment from Jennifer. The question about how, in your experience, the difference in the way ADHD manifests itself in girls versus boys. Do you have a comment on that?
Yeah, we've actually studied that. So I've been part of two big long-term studies that have sort of tracked individuals into adulthood. And first of all, boys tend to have more oppositional and conduct problems associated with their ADHD, and girls tend to have a little bit more anxiety associated with their ADHD. What we find is not that in general, girls with ADHD are a lot more similar to boys with ADHD than we initially thought. One of the questions that comes up is, since girls naturally, those just women and girls naturally have fewer symptoms of ADHD, when they have ADHD, we're actually judging them by boy standards, so to speak. So is it that they have a more severe form? Some people say when we diagnose girls with ADHD that they have more of a severe form. My experience clinically is that, and what we've known from outcome studies, is that girls and boys respond equally well to psychotherapies, to medication therapies. And, like boys, I have a number of girls that I follow now into college, and they're doing very well. I was just talking to one just the other day, and on Monday, and I was checking on her, and she's in college in medical school. She's had pretty significant ADHD, and she's doing terrific and really doing well, and she's learning to adjust her meds to be able to manage now the longer shifts and how to deal with timed issues and this and that. And she's starting now to move a little bit away from all the accommodations, and it's working out well for her. So, there's a girl growing up with ADHD the whole time I followed her and is now doing well in medical school, and I'm very proud of her, and
wow.
Her parents are very proud of her.
That's
for
great.
Her progress.
Yeah. Speaking of medical school, you mentioned one of your patients was pursuing electrician and being an electrician. Suggestions? Do you have some suggestions for helping children with ADHD, teens, young college students with ADHD figure out a career path, pursue a career path?
I think, so first of all, I want to just comment that my experience has been that when kids, one of the biggest positive prognostic factors for kids with ADHD is when they start to get jobs. And so I think the earlier you can get kids with ADHD jobs, it really helps because it starts teaching them to work, to get paid, to have structure, to responsibility. And one of the things I've learned is that kids often, their reward systems, there's a whole lot of theories about your reward system. Your reward system is I like chocolate, I want ice cream, I want, alcohol, whatever. And there's evidence that the kids' reward systems are different in ADHD. And I think that the earlier you help kids come in touch with the reward center, and one of them is motivation for working, which is pay and getting jobs, it's great because my experience has been those are the kids that when I track them long term do fine. They figure out things to do. And what I would say is if your kid is academically not particularly inclined, don't push them into college. Or if they're going to go into college, put them into a unique college setting. Be sure you check that out. If they like to tinker around with stuff, encourage that. Don't take that away if there's academic problems. If kids are good at sports, I encourage them to play sports, and I specifically will write letters if they have academic problems not to pull sports. If they're good with welding, if they're good with that type of thing, I would make a big point to have them focused in areas like that. The one profession I have not seen work out well for kids with ADHD is being librarians. So I would say to you, probably that's not what I would do. But again, I think it's really going to depend on the kid and opening up, thinking outside the box.
Interesting. Okay. Yeah. I mean, I think what we've learned is that what kids find really interesting and fascinating is what they do well at. So, and then of course, not too much detail. Let's see. Let me find some other. There's been so many interesting questions here. You mentioned that you approve of helicopter parenting, and someone wrote, "How long does this have to go on?" And similarly, this is another question from a parent who says, "My college student needs a huge amount of help organizing, planning, and dealing with important details, filling out forms, responding to emails. At what point do I just let him learn from the consequences versus saying to myself, his brain isn't able to do this yet?" I mean, I think this comes to the point of this helicopter parenting and how long it goes on. As she goes on to say, he's clearly not learning from the consequences yet. It's exhausting for me, but I do want to respect that he's not able to do these things yet. Just a question of how long do I go on, helping with this helicopter parenting role.
Yeah, and I would say until your son has a good significant other that can take that over from you, because there's going to be a certain component of that.
Right.
It's an issue, and I think in the question you really very subtly and savvy put in the balance there that the kid has to have some feedback that they've got to engage. So there has to be some component of them engaging, and that would be through some consequences. The problem is the kids could utterly, could really fail because of their issues. And the last thing you want is a failure in college because of consequences that were linked to something that really isn't their fault. So I think it's a dial up the pressure for them to do more and more. If there's forms to be filled out, keeping up on it and saying, okay, what did you do with that form? Let's work it out. You do it. I'll sit here and watch, or I'll be on the phone while you do it. You do it. Mm-hmm. Generally, most of that, most kids by around the age of 23 to 25 develop those skills. Kids with ADHD are delayed a couple of years. I would say by 28, most, and I'm thinking more boys on this one, girls are a bit earlier than that, but probably delayed out to 27, 28. So don't be surprised. I'll tell you one that trips up a lot of them is when they have to fill out insurance forms themselves. They're fortunate to get a company. They don't know how to fill out 401ks and all the pension things that are necessary and to set that up. That gets very complicated for them. And then I hear a lot with parents saying about insurance, that they totally screwed up their insurance through their company or whatever else. And that's because of the complexity and and they'll just shut down and not do it. So I think you're still going to be prompting and helping, and I would say extend it by a few years more than what your peers or friends or other family members who have similarly aged kids without ADHD.
Right. And not to be embarrassed by that, I guess. Yeah. Dr. Wilens, this was really a wonderful presentation. I can't thank you enough for your time. Listeners, we have two webinars coming up. Dysgraphia, a subject of lots of interest among our readers, on September 1st. And then on September 8th, Dr. Barkley will do the third of our three-part series on life stages of ADHD, addressing diagnosing and treating adults with ADHD. So I hope you'll check back for that, and don't forget to look for the podcast, ADHD Experts, on wherever you find your podcast. You'll find some really wonderful recordings from our presentations. And finally, if you support the work that Attitude does, we hope that you'll subscribe to the magazine, attitudemag.com/subscribe. We welcome the support, and we are grateful for all of our listeners. Thank you so much, Dr. Wilens, and thanks everybody for being here today.